Okay, so we are Ergo LED Pulse Finder. I'm Liam.
Seth.
I'm Daniel.
I'm Kyle.
I'm Nathan.
Okay, so as many of you all know, study the prompt well. The current IV problems faced by BMED are that there is a large variance in what patients can come into an ambulance. Moving ambulances can be very rocky depending on the place that you are, as well as like the urban environment. As most of you know, the first pass has about a 40% success rate in moving ambulances. And then from the missing of that first pass, it's very likely that the preceding passes will also be failures. And that can be due to combative patients and just hard working environments. And then something that's important to note is the first ticket time failure rate is up 21% roughly and for patients with more pigmentation in the skin. So the goal for us was to develop an easy to use, field appropriate tool to increase IV placement. And then for an edge case patient or user, we can like come up with a hypothetical of what's most frequently used in IV placement for ambulances, which would be car crash incidents. Most of the time, there is inebriation and intoxication involved with these accidents, which causes constriction of veins, which is oftentimes why it's hard to place first time for a intoxicated patient because they're often combative, moving, either limp, and their veins are defined. Sweet, so when we first got the prompt, we frantically, me and Nathan, went to hospital, trying to see if we can get interviews. So Nathan?
Yeah, so basically we wanted to learn what the problem was from real people that experience it. So we talked to Luke, who's an EMT in Oakland for 2 years. So he's not actually doing the IV, but he's assisting the paramedic when the paramedic does it. And he was telling us how common it is for them to not find the vein first try, how common it is for them to do even 1, 2, 3, 4 times where they miss the vein, rupture it, and have to find a completely new one. He was telling us how long it takes to actually find the vein. So there's a lot of problems with this current process in the back of a very tight enclosed ambulance. So this kind of gave us a frame of reference of things that we need to find and the problems with the actual current process.
Sweet. So we got lucky enough to, as we walked in, basically cold calling, walking into hospitals, to get an interview with Lauren, who is the manager of the emergency department at Adventist Health. It's near Foothill. And she basically walked us through how the entire process of the IV catheter is put in, and it helped us really narrow down our ideation and pointed out a few really important key design parameters that we're taking as we move forward. So the first one would be that strapping apparatuses are really difficult because the entire IV procedure right now currently is fully disposable, which means anything that actually touches with it, especially in an ambulance, anything that touches the patient needs to be thrown away. So oftentimes in hospitals, more expensive equipment will be washed off, but in the case of an ambulance, most things are disposable. Other thing is anything that straps to the patient is really hard to work with. That's because most of the time IV catheters are actually inserted into the crease of the elbow, so any bending, combativeness from a patient would need to be locked down. And if there were something like that, we wouldn't want to reinvent the wheel better than a disposable arm pad, which she was lucky enough to give us. And then the last one is that a lot of the insertion of the catheter is super skill-based and requires a full degree of freedom because the needle enters in at a larger degree, goes in, and then to prevent vein rolling, they actually, and for lack of a better term, and to quote her, she says she digs a little to find the vein and make sure that it moves. So anything that's guiding the needle would actually impede in the ability to properly insert that catheter. And that leads us to our solution. So it is a near-infrared light over device. It's highly ergonomic. It does not touch the patient. And then there's a few key features. So it has a larger battery, which means recharging is not as much of a problem. It also has clips here, and we'll talk about that later, which means that plastic polypropylene components will go above it, similar to an ear thermometer. We put it on, it touches the patient, and then immediately clicks off. And this is really important because in the demo that we got from the lead nurse, when she was opening packaging, things were falling on the floor, And in that moving ambulance and in that tight enclosed space, you need something that's gonna be sterile and disposable and rapid without having to have free missing hands. Yeah. Oh yeah, and then a quick demonstration as to how it would work. So basically the we'll explain this later, but the near infrared imaging would go over. It would be placed horizontally first, and because this grip is adjustable and does not touch the patient, it can be done like that. It would go over, it would find the vein, and then move it. However, from whatever angle they are going from, it is compatible. So sometimes the patient, they're sitting back on a further bench, or they're sitting in front, they'd be able to hold it and then insert the IV catheter into the elbow or hand, finger, wherever they need it to be.
Yeah, so let's get to how it actually works. So we've already looked at technology such as the vein light, which is where we got inspiration for this product. And the vein light works really well by using bright infrared lights to shine into the skin. They can actually vary the wavelength of light depending on the skin tone and the depth of the veins. And so we are trying to take the best technology that was implemented in the vein light, and we want to optimize it for use in an ambulance by EMTs. Currently, vein lights are designed for hospital use. That means they're great for when you're sitting at a bedside, you have lots of space around you, and things aren't moving around. But that's not the case in the back of an ambulance. Typically, some EMTs have access to vein lights, but it is not standardized. So being able to have a product that is optimized for EMTs was essential. And a few key design features of our product here. So first I want you to notice this kind of bend shape right here that conforms to the bicep and forearm, and that's optimized to get a better needle placement. You can see on Kyle here, when you put the vein light on, it conforms to his bicep, and it makes it much easier for EMTs to get that first needle stick. You can see 4 red LEDs on the bottom of the product here, powered by a 9-volt battery and a single switch. These are simple electronics and they're readily available. I also want you to notice a key difference between us and the vein light is that we have a guided channel right here. The vein light uses a circular design, whereas this product uses this channel, which will isolate a long vein and allow a nice smooth path for the needle insertion. We also have angle finders on the side of the product here. Next slide, please. Yeah, and so a few design features, we have feasibility. This has to be simple and intuitive. An EMT needs to be able to pick this up and know exactly how to use it right then and there. It's effective. This product is able to find the vein. Hopefully future iterations will have adjustable lights so that we can use it on a greater variety of people. And yeah, so judges, I want you to take a look at
I would think this, it's important to note that anything that does exist sits flush to the skin, and that is what causes one of the largest ergonomic problems with that, and that is often why it's not used in an ambulance, because the ergonomics are needed for like a seated environment.
And so I want you to notice the difference between our initial design and our prototypes with these sharp angled corners to our smooth end product. And that smoothness was, we got to that point because EMTs wear gloves and they can't be getting their gloves caught on any kind of sharp corners.
So a big part of this was the sterilization. As we know, in an ambulance, you have just a set amount of space, and you can't have a large UV chamber, and you can't be using a lot of equipment that already isn't in the ambulance that you want to utilize. So to sterilize this product, we're going to be using, we kind of got some inspiration from an ear thermometer, utilizing a snap-on e-sheath system, and that's going to effectively contact the patient at a certain location and provide a reusable and quick and cheap way to sterilize the product for every use.
So for our manufacturing plan, and if we were to start producing this today, we'd probably use 3D printing, but then we moved to injection molding for higher demand, and we'd be using polypropylene injection molding. And the snap-on sheath would be made from polyethylene, and then the rest of the assembly would be sourced parts, the LEDs, the number battery, and the switch. And then for our bill of materials, our total cost per unit would be about $23.20, and then with assembly costs, we estimate about $33.20.
Yeah, and that's because a lot of the components are would be sourced, so we would need more skilled manufacturers to fully assemble it.
Yeah, so quickly looking at our competition here, a lot of these devices that are currently on the market are big, bulky, some of them require stands, mounts, and overall they're just very expensive. Even the cheapest one, which is the Vane Light, it involves using a circular disc ring, while the vane you're looking for is ideally kind of a straight line, and this difference in design can make it difficult and for EMTs to hold it and find a suitable vane that is long enough to be able to be used for IV treatment.
Okay, I'll just really quickly get into market opportunities and go-to-market strategy, but the market's massive. The opportunity is that this is the first vane finder that's optimized for backup ambulance use using ergonomic shapes and a long vane path, which provides traction on the vane, which pushes the vane up instead of pulling the skin out, which hides the vane. And then, since it also is a sterilization system using blister packaging that goes around the entire device that's fully disposable, that's the also element that's fully sterile, which is really important for ambulances. And this one. For a go-to-market strategy, what we really want to do is test this in the field and then get this into training programs for paramedics. They're going to be the ones coming up with this. They're going to be learning on it. And once they learn with it and learn how to do this process with this aided device, when they go out into industry, they're going to feel comfortable. They're going to feel naked without this device, and they're going to be advocating to get this into their ambulances. So we're going to use a market penetration strategy to get these devices at a subsidized rate into the training programs, and then try to market it towards companies like Royal and other ambulance companies around. Yeah.
Great, quickly a couple next steps is we want to finish iterating upon the design, get better fitment, and source some brighter and different color LEDs. And once we've got the design, we want to make sure that we want to test for improper use cases and go to market. Thank you.